Knee arthroscopy came about 30 years ago. Prior to knee arthroscopy, if someone had a knee problem, they would require a full 3 or 4 inch incision to remove a torn meniscus or try to smooth down some arthritis or fix a ligament. When arthroscopy came about, it became overnight one of the best inventions of the 20th century as far as orthopedic goes. It allows not only better visualization of the knee joint, but also an easier way to fix problems. It's also done as an outpatient, and the patients are walking that day. In the days before arthroscopy, patients were in the hospital for 3 or 4 days, and it was really quite painful. Arthroscopy allows us to evaluate the entire joint, fix the problem, and get people going at a much faster pace than ever before. When orthopedic surgeons perform arthroscopy of any joint, arthro means joint and scope means looking with a little telescope. So we simply fill the joint up with a saline solution. We put the arthroscope in the knee, which has a camera attached to it, so we can watch the surgery on a TV monitor. We can look above the knee, bottom of the knee, back of the knee, all around the knee joint, and fix what we need to fix. Generally, it's 20, 30, 40-minute operation. People are up and about, out of the hospital within the hour or so. And I generally see people back 2 weeks after the surgery, and by that time they know that they're a lot better. And by usually 4 to 6 weeks, they're back to normal. If someone, of course, has a arthritic joint or something that's not going to bounce right back, then they still might have some problems. But overall, it's been a very good means to treat simple knee problems. The most common reason for a knee arthroscopy is a torn meniscus. Those are 2 little pads inside the knee that allow cushioning when you run and jump. Those are subject to tearing with certain twists. Even just simply bending over, one can tear a meniscus. When those are seen and diagnosed either clinically or through an MRI, they can be treated with an arthroscope, whereas before we made the incision and laid people up for much longer time. Sometimes arthroscopy can be beneficial in arthritis if there are some loose bodies in the knee, or if there's some areas of the joint surface that need to be smoothed down. And then sometimes patellar problems can be benefited by an arthroscopy. Patellas that are worn down or shift from one side to the other can be benefited. Most of the time, though, someone has a meniscal tear, and it's a very good means to treat that. Well, they used to call it Band-Aid surgery, but what we do is we do the surgery through 3 little incisions. One has the flow that brings the fluid into the joint. It's like looking around underwater. The other portal is for the arthroscope, and another portal is to operate through to trim out the meniscus tear or whatever you have to do. So when we get done, we simply put dressings on the 3 incisions. Some surgeons close the little incisions. Some people just put a butterfly strip on it, dressing. And generally I leave the dressing on for 2 days, then I let them take it off and they can shower. I have them use a cane or a crutch for a day or 2, but a lot of times that just slows people down. So they just up and going, and depending on what surgery they had done, whether they get swelling or maybe some bleeding at times, people recover fairly quickly. Obviously, the more extensive the work that you have to do inside the knee, the longer it may take for someone to get over it. The beauty of St. Luke's Hospital is that it covers a wide range of orthopedic problems. We have specialists in hand, foot, ankle, knee, shoulder, hip. Practically any orthopedic problem can get done right here. Most of the time we can do some of these things as outpatients, and sometimes we have to bring people in the hospital. But from the moment a patient hits St. Luke's Hospital doors, they're greeted warmly, they're taken care of as if you would take care of one of your own family members. Surgery's performed, they get recovered, and back to either home or to the hospital room. So I don't think you can find a better choice in a hospital than St. Luke's Hospital.